it's the last couple of days of May, which is Celiac Awareness Month, so I wanted to talk a little bit more about it. Not that it's not worth talking about every day of the year. Where we stand with celiac disease is that it's one of the most common autoimmune diseases, yet close to 90% of people who suffer remain undiagnosed. Ridiculous. Why is that? Why is that? I think it has to do with the testing, which is not foolproof. Doctors not being up to speed on the fact that requiring a biopsy and a biopsy being positive is the gold standard for testing of celiac disease, which it is not. I've done many videos and blogs on the 4 out of 5 rule, which is that you have to have symptoms associated with celiac disease. You have to feel better when you remove gluten. You have to have a positive blood test, a positive genetics test, and the 5th is a positive biopsy. So 4 out of 5 rule means you can have 4 out of the 5 positive and still be deemed a celiac. So considering the most expensive and most invasive is the biopsy, that means it's not required for a proper diagnosis. Yet so many gastroenterologists are still stuck in this pre-2014 mode of thinking that it's the gold standard. So it is not. If that's what your gastroenterologist is telling you, they are not up to speed, and you should find another one. This month we're offering, so for the next couple of days, $50 off the Wheat Zoomer test, it is called. So it's a blood test, but what I love about it, it gets the spectrum from celiac through gluten sensitivity as well as leaky gut. It gives you a lot of data about whether you're sensitive to gluten and or have celiac disease. So yeah, so that's fun, something we've never done before. But when it comes to getting back to the problems of diagnosis, typically doctors don't like to talk about diet. They don't like to restrict diet. They'll say eat healthy. If you are diagnosed with celiac, so you're one of those 11 or 12% that actually get diagnosed, then you're just referred to a dietitian, typically in a hospital, and they'll just kind of go over places where gluten can be found. They won't necessarily talk to you about all the other things that you need to eat versus not to eat, and you just become gluten focused, which is very important, don't get me wrong. But there's also a lot of gluten-free junk food out there which you should not be eating, and in order to heal your gut and heal your immune system, there's a lot of important nutrients that you need that go above and beyond that. And the other thing is, between celiac and gluten sensitivity, there's a lot of systems involved, and we think celiac and we think gut. You know, we think GI symptoms, diarrhea and bloating and weight loss. It can also be weight gain in adults. Children, failure to thrive. They tend to be on the thinner side, short of stature. But as adults, you can be normal weight, you can be overweight, still have celiac disease. But there's also the neurological aspect of it, migraines, even seizures, neuralgia, pains or numbness in parts of your body, fatigue, poor sleep, other autoimmune diseases. As soon as you have thyroid issues, you definitely want to look into whether you have a celiac or gluten component as part of that, because we know gluten does have a propensity to injure the thyroid. But we have hormonal imbalance, and you can have not just fatigue, you can have anxiety, depression. There's a lot of systems involved. The skin is another big one, not just dermatitis herpetiformis. That's a mouthful. They abbreviate it DH. It's a little easier. But yeah, not just the DH associated with celiac disease, but other skin conditions like eczema, psoriasis. You really want to rule out whether gluten is a component there. So all these systems are involved. The testing is not perfect. So getting a doctor who really understands the nuances, and again, that spectrum from celiac to gluten sensitivity. Gluten sensitivity is not celiac disease light. You know, it's not like, oh, well, it's not the bad thing, so I can have a little gluten sometimes. I mean, a lot of patients who just was talking to a woman the other day and hadn't seen her in a couple of years. She's like, yeah, I'm back to this and that. And I was like, so how are you doing being off gluten? She goes, yeah, okay. So as soon as I hear that, you know, My little red flag starts waving up in the air. So I said, what does that mean exactly? She goes, well, I'm mostly avoiding, bread and pasta. It's like, oh boy. So, it's just this re-education that has to happen. And it's not just those with gluten sensitivity, it's those with celiac as well. The problem can be is that some people cheat on gluten, whether inadvertently they get it in their diet or they choose to cheat and they don't feel it right away. And that can be very insidious. I always tell the patients who get an instant migraine or something instant happening to them, I'm like, you're so lucky, because you won't get tainted without knowing it. And if you cheat, now you're going to have this aversion therapy to gluten because you feel terrible and you don't want to do that again. So they're lucky. It's the people that have more of a delayed response that kind of wait all day. They cheated, they had the cookie, they had the pasta, they go, okay, seems all right, and then a few days later things start to happen and they've already forgotten they cheated. So it's really important that everyone knows whether they're sensitive to gluten or not. And that's not saying everybody's sensitive, they're not. But it's such a big miss. It's such a big thing to miss when it's present. So take advantage of this $50 off the test called Wheat Zoomer. If you're seeing this later, you can still do the test. We've never offered a discount before. We thought it'd be nice for Celiac Awareness Month in May. But do yourself a favor, really find out, family members as well. It's an easy test. It is a blood test, but not hard to do. And if there's anything about your health that you haven't been able to get to the root cause of, and there's something underlying it, you just can't figure it out, or maybe you've been on medication for a while and you're not feeling good with that, or the medication keeps increasing, whatever it is that's bothering you that shouldn't be bothering you, because remember, the body knows how to heal itself, and if it's not doing that, there's a reason why, and that's what we do here at Root Cause Medical Clinic. I hope you found this video helpful. If you want more on this topic and others, click here.